Being healthy, it's not just about reacting when problems show up. A big part of it is getting out ahead of things.
Like heart disease. As we imagine better health, an event where you can get the facts about how you're doing today and which factors might affect you later on.
From CHI Health, Pam Gaines and Kristin Boothby. Thanks for stopping
Hi,
by.
welcome
Good morning.
back.
Thank
Nice
you.
to meet
Pam, we want to get to your story in a second, but let's talk about heart disease in general. It affects, obviously, both men and women. How
Exactly.
significant is it?
Number one killer in for both men and for women.
And we talk about the symptoms being a little bit different, but what you're doing on Saturday, it's really about facts, customized to everybody who comes through with all of these screenings. And this isn't about you working at CHI Health. This is a passion of yours because of your own story.
It is.
What happened?
Well, it's actually been 20 years now since I had a heart attack, but I was at home with very vague symptoms, and that's one of the things that we've learned over the years is that women do have much more vague symptoms. So my particular symptoms was a little bit of heartburn, anxiety, and elbow pain. And so I knew that those were symptoms that weren't normal for me, and of course I was a cardiac nurse at the time, drove in, but since when I was in the emergency department, my symptoms were so very, very vague. It took a while to get it diagnosed, and so eventually I did have the heart attack in the emergency department. And I think that's one of the reasons why I've always cardiovascular disease is so important to me professionally and personally. So
It's so important that you recognize those signs and got to the emergency room when you did, isn't it?
right. And to be able to share that over the years with, not women specifically, but for men too. Men have a tendency to ignore their symptoms.
Don't they? Don't they?
What?
What do you see day to day at work, Kristin?
So I'm a nurse practitioner. I work in the cardiology office in the hospital, and I guess what Pam and I wanted to sort of bring forward and talk about today is most of the risk factors, many of the risk factors for the development of coronary disease are silent. And so when people have high blood pressure or they have high cholesterol, we know certain things like smoking and obesity and some of the identifiable risks, but some of the things are silent. And so really it's important to have a screening and get your blood pressure checked, get your blood sugar checked, and sort of prevent all the things that you can prevent that may be silent that put you at risk for having coronary disease.
Yeah, like some of those things that you mentioned, smoking, obesity, but then also things like family history also plays into this too, so that's another indicator.
Right, and what we see that's so important is that there are certain things we can't change. We can't change our family history, but we can change a lot of things, but part of it is we need to know about them and identify them, and so we really, I know that Pam is personally passionate about this, but we all want to get the message out there that screening is so important, and you can identify the risk factors and then modify those risk factors that you can modify.
It's never too late. And for anybody, no matter how old you are, it's never too late to start taking control of your heart health.
Exactly.
I love what you're doing this weekend because a lot of this stuff, typically, some of this would cost you money throughout the year, but they're doing a lot of free assessments at the Heart Fair on Saturday. We're looking at cardiovascular, sleep apnea, lung function, depression, high blood pressure, and then there's a suite of services you're offering at such a reduced cost. I mean, it's sort of like almost laughable at what some of this costs in the real world and then what the prices are on Saturday. So either of you walk us through some of these values and what we can learn by some of these screenings.
So we can, we'll have EKGs and some of the other screening tools are used to identify, like, are you at risk, who's at risk, and then sort of make a judgment call. There's some advanced practice nurses like myself will be there and determine who needs a further evaluation in this. So like sleep apnea, okay, if you meet the criteria or if you are determined that you have risk for sleep apnea, then we'll refer you to the appropriate specialists. And so the screening tools are really used to identify what your risks are.
Yeah, so I was going to say, because after some of these tests, whether it's an EKG or maybe a thyroid screening, people are going to have questions about these results. So where do they go?
And we're there, and I'll be there, Pam will be there, and we have a whole staff of people that are, volunteering their time and that do this every day, that can sit down and answer questions and troubleshoot and then get them to the appropriate referral specialists. And we have a a lot of people that, you know, hopefully we can register beforehand and get them in, and then we can, if anybody has any questions, we have a team of people that can help.
I see you smiling, Pam, when she says, hopefully we can register, because that's the goal, right? Even though we say some of this stuff is free, some of it costs just a little bit of money compared to, do you have to register before coming on Saturday?
We suggest and we hope that you have time to get online and register, but we will take walk-ins. And we really, this is a community event, we want you there.
Yeah,
So
right.
we have a lot of education that we provide. The free screenings are just awesome, but we also have a wide variety of other education tables.
So nutrition is such an important part of
Exactly.
this picture. Will you have dietitians there, for example, to talk to folks about what to eat and drink and, you know, what's good for their heart and isn't?
Absolutely. We'll have actually 2 dietitians, and it's really a very important part of what we do. Is it's very popular with our folks that come through. But we also have things like stroke, chest pain centers. Diabetes is very, very important for heart disease. So our home care. So there's a lot of folks really just waiting to provide our education on heart disease and for everybody.
Men and women.
Men
Because
and
some
women,
events
for
are
everybody.
specific to like, oh, we hear, you know, certain times of the year, this is
Yes.
for the ladies, this is for everybody. What's
is.
happening on Saturday?
Right.
It's the CHI Health Heart Fair with those free heart assessments, and then if you need one of those other tests or you're interested in one of the add-ons for such a reduced cost, think about that. It's at CHI Health Lakeside. Just park in front of the hospital. If you are going and you know for sure, register now at chihealth.com/heartfair.
You don't need to bring anything with them. I know family history is one thing that you want
Like
to
insurance
look at.
stuff. I mean, since it's
Anything?
a reduced.
Nope, they don't have
Any
to bring
medical
anything. No, absolutely not. What's so unique about our program that I don't think that you get at other health fairs is we have the advanced practice nurses that really can look at your individual risk after you've had your screenings and help you make an assessment on what needs to be done next.
Just take care of yourself.
Yes.
Right? It's
Yes.
so easy with stuff like this. Thank you both for being here. I know we're out of time. Pam can go on and on and on and on. That's why we love her, because this is really a matter of the heart. Really, really. Thank you both.
Thank you. Thanks a lot.
Still have the connection.